This is Biology Unit 5 revision video for blood and heart repair. When people want to give blood, they can go to what we call blood banks. This is entirely voluntary and you can give blood 3 times a year. Now when giving blood, you've got to consider blood groups being carefully matched between the donor and the recipient of the blood. There are 4 main blood groups. These are A, B, AB and O. Now there are a number of reasons why people might need blood transfusions. These include people who have had an accident or injury and have lost a lot of blood, or during surgery where they've lost a lot of blood. It could be haemophiliacs who have abnormal clotting within the blood, and some cancer patients can also need a blood transfusion. Donated blood is refrigerated before it's transfused. This is to preserve it for as long as possible. Now it cannot be transfused into people like this, it has to be warmed before it is given. If given to the person cold, if transfused cold, it can cause the body to go into shock and it could actually kill the patient. Now when you cut your skin, your body will immediately begin to heal it. This happens due to platelets in the blood becoming exposed to the air. We get lots of chemical reactions happen and another protein in the plasma changes from being soluble to insoluble, and this protein is called fibrin, and fibrin fibres along with the platelets will form a clot. Blood that has been taken from someone, that has been donated, if it's kept in a bag and stored, the blood would clot in this way. Now to prevent this from happening, we add chemicals to block these chemical reactions and prevent this clotting happening, or what we call coagulation. Vitamin K is essential to help blood clot effectively. Bacteria in the digestive system make vitamin K, but it can be added to the diet by eating items such as green vegetables and cranberries. So here is summarised the process of a clot forming, and this is what I've mentioned earlier, but here it is in text form if you would like that as help. Now what I'm going to look at now is what factors could cause abnormal clotting. Now, some people suffer from a condition called haemophilia. This condition causes the blood to clot very slowly. People who have got fatty deposits within the arteries are at higher risk of developing clots due to a narrower passageway for blood to travel through. This can cause heart attacks and strokes. Also, things like smoking and drinking alcohol can increase the risk of blood clots forming. We can use chemicals such as warfarin, aspirin and heparin. These are medicines that we use to reduce the ability of the blood to clot, and these can be used to reduce the risk of strokes. If the blood of the donor and the recipient are not properly matched, a process called agglutination can happen. This is clumping or clotting of the blood, and if this occurs in the blood, it will prevent it from circulating properly and the recipient of that blood could die. Here is a diagram of a red blood cell. Contained as part of the membrane are proteins called agglutinins. Now these are a type of antigen. Now, different types of blood have different shaped antigens on the cell membrane. Your body produces antibodies against agglutinins. However, you don't have antibodies in your plasma that can react with your own antigens that are found on your own red blood cells. So for example, if these here are the antibodies against the agglutinins, the ones that could exist in your blood are this one and this one. This one here could not be in your blood as it is the shape that will fit these agglutinins on your red blood cell, and if this happens we will get agglutination or clotting of the blood and you would die. So it makes no sense that your body would make this antibody. However, this is why matching blood groups is really important, because this has got to be considered when donating blood and transfusing blood. So for example, we don't want to give this person a blood transfusion where the antigen is this shape, it produces the antibodies here for that, and clumping would occur. So this table here shows the different blood groups, the agglutinins on the surface of the red blood cells and the antibodies in plasma. Now we can see here, by comparing them, which blood groups can be donated to which other blood groups. So if we start with blood group 0, this has got no antigens, no agglutinins on the surface of the red blood cells. This means that any of these antibodies have got nothing to attach to clump. So this is what we call the universal donor, as it can be given to any of these other blood types. As contrast to that, group AB is what we call the universal recipient, as it can receive blood from any other blood group. This is due to the fact that they have no antibodies in the plasma, so the antibodies are not there to attach to the agglutinins on the surface of the red blood cells, so we won't get clotting happening. People who have blood group A cannot receive blood group B. This is due to the fact that in A we've got type A agglutinins, and in B we've got anti-A antibodies. So that does show that with blood group B, these would attach to the agglutinins on the surface of the red blood cell and cause clotting, so this would lead to death. And vice versa with B, we cannot get the agglutinins here mixing with these antibodies in blood group A, as they would join together and attach and cause agglutination and kill the patient. Blood groups are also classified on another basis, which is on rhesus factor. Now this is a plasma protein, and you are rhesus positive if you contain this plasma protein, and rhesus negative if you don't. Now if you are rhesus negative and you receive blood from rhesus positive donor, then you would make antibodies against the D protein and we would get agglutination occurring. So you can only have rhesus negative blood if you are rhesus negative. So next we're going to look at heart repairs and artificial pacemakers. Now artificial pacemakers can be used for people that have irregular heartbeats. Now if you've got an artificial pacemaker, it's implanted under the skin via a wire passed from a vein to the right atrium, or if you've got a damaged atrioventricular node, to the ventricle. Pacemakers have long life batteries. They need to be replaced about every 10 years. They send impulses to the heart muscle. That makes it contract in the correct rhythm, and what's really clever about these is that they can detect if a person is exercising or being more active, and it sends impulses to increase that heart rate. Another issue that can occur in the heart is a hole in the heart, and this is an issue because, for example, if this is a hole in the wall between the two sides of the heart, we can get blood flowing directly from one side of the heart to the other via this hole. This would lead to being less oxygen in the blood, and the person would become fatigued, breathless, and this would need to be closed via surgery. Now this actually starts out as something quite normal. Fetuses within the uterus have got a small hole between the left and right atria, so these here, and they get oxygen from the placenta as they don't breathe, and the oxygenated blood enters the right side of the heart, flows through the hole to the left atrium to the head and body. There's actually a connecting vessel between the pulmonary artery and the aorta, so that blood will bypass the lungs as it doesn't need to go there yet, and at birth the baby needs to oxygenate its blood via the lungs rather than the placenta. So the hole closes, the blood flows the normal circulation, but in some babies the hole does not close. This allows oxygenated blood to flow from left to the right atrium, so a smaller amount of oxygenated blood leaves the left ventricle and the body tissues receive less oxygen. Valves may need to be replaced at certain points in life, whether it's from old age with the heart valves becoming stiff so they don't work as effectively, or if they've become damaged by an infection of bacteria such as an infection called endocarditis. If they do not work properly, the blood will flow backwards. This can lead to heart failure and not enough oxygenated blood reaching body tissues, which will lead to breathlessness and fatigue. Now these can be replaced by surgery via animal valves such as pigs or cows, or they can be given artificially. Now with artificial valves there's no risk of rejection because they do not have a blood supply. Now bypass surgery could be used for people who have got blocked arteries. Now this can become a problem if eating saturated fat or fatty deposits build up around the artery wall. This can obstruct the flow of blood, and your heart muscle then does not get enough oxygenated blood. Not receiving enough oxygen will cause it not to contract efficiently, and then you may develop conditions such as angina or a heart attack. So bypass surgery works where they take a piece of blood vessel, which is usually a vein, and it's taken from an arm or leg and transplanted to bypass the blockage in the coronary artery. Now if someone's just had a heart attack, to do this really quickly they can insert a stent, which is a tube that will open up the blocked artery. If this is done soon enough, the damage to the heart is minimised. The last resort with this is a heart transplant. Now, the first one was carried out in 1967 and they are really quite common these days. This operation is what we call traumatic, and the person must receive immunosuppressive drugs to prevent the body from rejecting the organ. On top of this, all operations also carry a risk of infection.